feel like, and this is maybe just my personal opinion, California state is so emblematic of, I guess, the response and progression of care and prevention of HIV, given its role so early into the spread and the epidemic's discovery and all the research that's come out of there. Do you guys, I guess, you and your colleagues in your home state, do you feel that sort of responsibility, or is it just something that's sort of advantageous because, again, from the jump, from the earliest cases, it was, again, coming out of that state?
Yeah, that's a great question. I think we do. I think anytime we have done something that we think is working well, there definitely is a feeling and an obligation to sort of disseminate that. And that, I think, like you're alluding to, can often be kind of the last thing on your list of to-dos. You've got all of these emergent things to deal with day to day. As you can imagine, in a program like this, there's always complexities where somebody should have been enrolled and they weren't enrolled. And so there's a lot of putting out fires, trying to deal with the urgency of the day. But I think you're right, getting this out, we do feel like that is definitely really important. And on the other hand, we try to, as much as we would like people to kind of borrow our ideas, we are also very active at borrowing other people's ideas. So last year we had one of the medical directors from Seattle-King County come down, talk to us about their program, what some of the innovative things that they've been doing. We are often on the phone with New York City and New York State, trying to hear what's kind of the newest thing that they're doing. Because often I think it can be easier to try to figure out what's working in another scenario and figure out, would this work with what we're doing, rather than trying to start it ourselves. And I just mentioned 2 states, but I think it's really across the country. Iowa's got a really innovative tele-PrEP program. We've been really kind of working hard to try to get our tele-PrEP going, and have kind of been looking at their model to see what we can learn from what they're doing. So I think that, and then the umbrella over all of this is CDC, and that they really encourage that communication between us. Unfortunately, that usually we have a meeting every year where all the state health departments come to CDC and people talk and exchange. And so that's being delayed, and it's probably going to be done virtually as well. Hopefully we can continue to exchange those ideas, though.
Yeah, absolutely. And it sounds like you guys have such a well-established and just beneficial network of collaboration across the region. So that's really great to hear. And Dr. Peters, another thing that's pretty big, at least almost borderline headlining news at AIDS 2020 in terms of some of the clinical data, of course, is improved understanding of PrEP options for patients. Now looking at long-acting injectable options, right, that could maybe address the burden of patient adherence from the daily oral pill, and just kind of put them in the driver's seat for managing their own risks. And again, this is data that's coming from a very diverse patient population, right? That was something that was stressed up front, is that, we're not testing this in a very particular group. It's anyone who's really at risk here. We made sure that it's clarified for that. How do we imagine, I guess, the advancement of PrEP therapeutic options to, obviously, I imagine it's a positive effect, but how exactly would it affect the assistance programs?
Yeah, no, I definitely think you're right, that it's a positive development. I think we really, as you're alluding to, we really need a menu of different options. And so now we have 2 highly efficacious oral medications. The data looked really good from the HBTN 083 study we saw presented 2 days ago. So hopefully that's going to become an option soon as well. And I think you're right that there's going to be different, the more options we can provide for people, the better HIV prevention efficacy we're going to see in a real world setting. For some people, the daily oral medication is going to be the right option. For others, an injectable that they're doing every other month is going to be the right option. One thing we tried to get ahead of is the, really because our stakeholders were bringing it to our attention, was the option for on-demand PrEP. So more sex-driven PrEP, where people who are not necessarily having as many potential exposures to HIV can manage the amount of pills that they're taking so that they can take PrEP over a period of time where they're having exposures, but then are not taking PrEP when they're not having any exposures. So I think you're right, and I think what you're getting to is having flexibility. We're definitely going to need to have more and more flexibility with these new options. But with an injectable option for PrEP, I think it really speaks to even more importance for having a PrEP assistance program, because you know, in many ways, the day-to-day becomes less intense for a person because they're only getting an injection once every 2 months. But on the flip side, the medical piece of it is more intense. So you got to come into the clinic every other month. You got to have those appointments need to be taken care of. There's going to be nurse fees, physician fees, different laboratory testing to make sure everything is safe. There might be, telemedicine visits. So there's all of that that's kind of not covered in the cost of the medication, which is usually the first, because that's the most expensive, that's the first piece that's being dealt with. But to really give people access to this in the real world, we definitely are going to need to incorporate those additional services into our assistance programs. So fortunately, as these programs, as we've kind of built our program to be closely affiliated with our ADAP program, we've heard a little bit already about cabotegravir because it seems like it's moved forward more quickly for HIV treatment. So we're already kind of thinking on the treatment side how we're going to pay for all of this, try to get that kind of experience and that knowledge on the treatment side for what's really involved, so that when it does become available for PrEP, hopefully we could pivot really quickly and be able to provide those kind of wraparound services for PrEP as well.